Sir, Kawasaki disease presents with persistent high fever exceeding 5 days duration, which this patient clearly doesn't demonstrate. You've obviously been reading outdated online medical information. The fever is cyclical. You've been checking his temperature at standard 6-hour intervals, completely missing the specific spike pattern. Check your detailed nursing records from 6 a.m. and 2 p.m. yesterday. There was a documented spike to 104.2 degrees at 6:17 a.m. yesterday, and another to 101.8 degrees at 2:23 p.m., but they normalized within 2 hours. But he's a janitor. How could he possibly know this? Because I didn't always clean floors, Dr. Peaton. Because while you were protecting your ego and your reputation, a child's life was slipping away. And because I refused to stand by while arrogance and prejudice blind brilliant minds to the truth right in front of them. You want to know how I know? I know because I am a physician. And this child has incomplete Kawasaki disease, which, if left untreated for another 4 hours, will cost him his life. Mount Sinai Hospital's pediatric wing hummed with a deceptive calm at 3:15 a.m. Deceptive, because beneath the surface, a storm was brewing. 12 of the East Coast's most prestigious specialists, a collective brain trust whose annual salaries could fund a small nation, huddled around glowing screens and cluttered charts. Their reputations, meticulously built over decades of Ivy League degrees and groundbreaking research, hung by a slender thread. The rapidly deteriorating condition of an 8-year-old boy named Tommy Rossini. Dr. Richard Peaton, a man whose tailored designer scrubs seemed to exude confidence and whose Harvard Medical School diploma practically shimmered in the harsh fluorescent lights, commanded the room. His Rolex, a beacon of his success, glinted as he gestured decisively. Ladies and gentlemen, we're not just dealing with a medical anomaly here. We're dealing with a high-profile patient. Mr. Rossini, the boy's father, has significant connections throughout the city. Let me be unequivocally clear. Failure is not an option here. A tremor of unease rippled through the assembled residents. Everyone knew Vincent Rossini, or Vinny as he was whispered about in hushed tones. The newspapers, with their sanitized headlines, called him a businessman. The streets, however, told a different story. A narrative woven with threads of influence, intimidation, and an unwavering, ruthless resolve. Outside the ICU, Vinny paced with the restless energy of a predator in a cage. His $1,000 suit, now a rumpled testament to hours of helpless vigil, clung to his powerful frame. The gold pinky ring on his finger, a symbol of his world, glinted ominously as he gesticulated wildly into his phone. I don't care if you have to wake up the damn Pope. Get me the best pediatric specialist in the world. Now! This was a man who solved problems with money and influence, with a phone call or a whispered word in the right ear. Restaurant owners in Little Italy knew his name and feared it. City council members returned his calls with trembling haste. When Anthony Caruso, a formidable figure in his own right, had donated a cool $2 million to this very hospital wing, it was Vinny who had made the introduction, leveraging favors and allegiances. But medicine, with its inscrutable mysteries, didn't negotiate with power. It certainly didn't respond to threats. Tommy's all I got left since his mother died. The vulnerability, raw and unexpected, briefly fractured the tough exterior, revealing the terrified father beneath. It was a rare glimpse into the chasm of his private grief. Dr. Samuel Washington pushed his cleaning cart down the hallway, moving with the practiced invisibility that 15 years of janitorial work had etched into his very being. He was 68 years old, his distinguished silver hair a quiet rebellion against the humble uniform he wore. Behind wire-rimmed glasses, intelligent eyes, sharp and perceptive, reflected a brilliant mind. A mind trapped, he knew, in a system that steadfastly refused to see his worth beyond the dust and grime he meticulously cleared away. A young resident, flushed with the urgency of the moment, blocked his path without so much as an acknowledgement. "Move it, Gramps, we've got real work to do here." Sam stepped aside silently, his dignity intact despite the casual dismissal. He had long ago learned that resisting such slights only amplified the indignity. Dr. Peaton, catching sight of Sam lingering near the periphery of the frantic medical discussion, waved him away with visible irritation, as if swatting an annoying fly. "Can someone please keep the cleaning staff out of here? This is a restricted consultation." A nurse, emboldened by the chief's disdain, added with a casual cruelty that stung Sam more than she could ever know. "That old guy's been hanging around here all night. Probably thinks he understands what we're talking about." Another, a younger resident, snickered, a sneer twisting his lips. "Right? Like he went to medical school. Oh, if only they knew. If only they knew that Sam, the invisible janitor, had graduated summa cum laude from Howard University Medical School in 1978. 45 years of medical brilliance systematically excluded from practicing at prestigious institutions like Mount Sinai, simply because cultural fit was deemed more important than sheer competence. Hidden beneath his cleaning rags, tucked away in a worn leather pouch, lay a stethoscope, polished with a care that belied its years of disuse. Medical journals, dog-eared and meticulously annotated, wrapped in grocery bags, lined his cart. Cardiology research, pediatric case studies, continuing education materials. He devoured them during break times, his mind alight, while everyone else assumed he was illiterate, or at best, simply bored. As Sam approached to empty a nearby wastebasket, he caught fragments of the increasingly desperate medical discussion. The symptoms they described: intermittent fever, polymorphous rash, conjunctival irritation, a pattern, stark and undeniable, immediately recognizable to his experienced mind. Dr. Piton, ever vigilant for any perceived challenge to his authority, noticed Sam's focused attention. "Excuse me, what exactly are you doing?" "Just emptying the trash, sir." "Well, do it somewhere else. And next time, knock before entering a medical consultation. Some of us actually went to school for this." The resident snickered again. Another nurse whispered loud enough for Sam to hear, a smirk playing on her lips. "Probably thinks those TV medical shows make him qualified." Sam's weathered hands tightened on the handle of his cleaning cart. These same hands had once performed life-saving cardiac procedures, precise and unwavering. Now they were deemed only good enough for menial labor. The dismissal, the mockery, cut deeper than any physical wound. Through the ICU window, Sam watched Vinny, the fearsome businessman, hold his son's small, lifeless-looking hand. The tough guy facade had crumbled completely. This wasn't a mafia boss. This was just a father, utterly broken, watching his child slip away. Kawasaki disease, incomplete presentation. They're missing it because they're looking for textbook symptoms. He moved away from the conference room, a profound weariness settling upon him. But who, he thought, would listen to an old black janitor when 12 Harvard-trained specialists couldn't see what was right in front of them? Hour 6. The conference room, now grander and more imposing, filled with New York's most prestigious pediatric specialists, each one summoned by Vinny Rossini's growing desperation and the thinly veiled, yet potent threats that underscored his requests. Dr. Amanda Carter, a sharp, brilliant mind from NYU, arrived with her meticulously organized team. Dr. Robert Martinez from Presbyterian, known for his groundbreaking research, followed closely. Dr. Sarah Kim from Cornell, her research fellows trailing behind her like eager acolytes, joined the elite gathering. These were the medical titans of Manhattan, the best of the best, their collective intelligence theoretically limitless. Yet, despite their combined expertise, Tommy's condition continued its relentless, terrifying deterioration. Dr. Piton led the discussion, his frustration now a palpable, festering wound on his ego. "We've systematically ruled out bacterial infections, viral syndromes, autoimmune disorders, metabolic diseases, genetic conditions, every conceivable avenue. The child presents with a constellation of symptoms that defies conventional diagnosis. Charts, lab results, imaging studies, consultations from specialists across the country, all were spread across the polished mahogany table like discarded battle plans. All normal, all useless. His fever spikes every 6 hours, then normalizes. We've documented temperatures of 104, then 98.6 within 2 hours. The rash appears and disappears. Polymorphous, nonspecific. Could be anything or nothing. It's maddening. Latest blood work shows white count normal, inflammatory markers slightly elevated, but not significantly. It's as if his body is fighting something we can't identify. A ghost." Sam entered quietly, a phantom figure moving amongst the giants, there to empty wastebaskets, a part of the background, an invisible fixture. He moved around the table with practiced invisibility, his presence unregistered by the self-absorbed professionals. But as he reached for Dr. Carter's empty coffee cup, he froze. The symptoms chart, a meticulous documentation of Tommy's suffering, lay directly in front of him. Fever patterns, rash documentation, lymph node measurements. His medical mind, honed by decades of rigorous training and practical experience, processed the information instantly. 45 years of diagnostic brilliance, repressed and ignored, now screamed the diagnosis these specialists were missing. The pieces clicked into place, forming a complete and terrifying picture. "Excuse me, the pattern of symptoms you're describing, Dr. Paton's head snapped up, his face twisting with a mixture of disbelief and utter disgust. How dare this man, this janitor, interrupt their hallowed deliberations? Are you seriously interrupting a medical consultation? Sir, I believe I can identify... Security, please escort this man out immediately. This is precisely why we have protocols about appropriate boundaries. Dr. Carter looked profoundly uncomfortable, her gaze darting away. Dr. Martinez turned his back, feigning interest in a lab report. Professional courtesy, it seemed, did not extend to black janitors who forgot their place. I just wanted to help. Help? You can help by emptying the trash and staying out of conversations between actual doctors. Did you get your medical degree from Wikipedia University? Or maybe he watched House reruns and thinks he's qualified. A nurse, a picture of casual cruelty, added with a snicker. He's probably been reading medical textbooks while emptying our trash cans. Think that counts as continuing education? The humiliation cut deep, a searing wound that reopened decades of similar slights. 68 years old, one of the most brilliant diagnostic minds of his generation, being openly mocked by medical students who couldn't match his experience on their best day. Security arrived, 2 burly guards who had known Sam for 15 years. They averted their eyes, unwilling to meet his gaze. The racial dynamic, unspoken yet undeniably present, hung heavy in the air, clear to everyone in the room. Come on, Sam, you know you can't be in here during consultations. He was trying to diagnose a patient, a custodial worker attempting to practice medicine without a license. The audacity is astounding. Typical. They watch medical shows and think they understand complex pathophysiology. Next, he'll be asking to scrub in on surgery. Sam's dignity crumbled. His shoulders, usually straight, slumped under the immense weight of the injustice. These people saw him as entertainment, a delusional old black man who didn't know his place. His cleaning cart rattled as security escorted him out, the sound echoing down the sterile hallway like a funeral march, a poignant requiem for a career that had never truly been allowed to begin. Other hospital workers stopped to stare, their expressions a mix of pity and discomfort. The story spread quickly, morphing into a morbidly fascinating tale. The crazy janitor who thinks he's a doctor. Rosa from housekeeping, a kind older woman, shook her head sympathetically. Poor Sam. All that late-night reading has gone to his head. In the break room, Sam sat alone, his coffee growing cold. Other custodial staff avoided him. Word traveled fast in a hospital, a microcosm of society where status and perceived worth defined interaction. He was the black janitor who embarrassed himself trying to play doctor. Rosa, despite her initial apprehension, approached him carefully, her voice heavy with pity. Sam, honey, you can't be interrupting those doctors. They went to school for 8 years. We just clean up after them. You know how it is for people like us. People like us. The words stung, not because they were malicious, but because they were true. In this hospital, in this society, skin color and perceived social standing often determined credibility more than actual knowledge. Sam stared at his weathered hands. Once steady enough to perform the most delicate cardiac procedures, now deemed unworthy to even offer an opinion. The system, which should value healing above all else, had reduced him to invisible labor, to a shadow in the hallways. He was a brilliant mind, a physician, yet his uniform defined him. Hour 8. Tommy's condition continued its agonizing descent. Vinny, his composure completely shattered, cornered Dr. Piton in the hallway, his eyes blazing with a mixture of grief and barely contained fury. You said you were the best. My son is dying. And you got nothing. Mr. Rossini, we're exploring every possible avenue. We've consulted with specialists across the country. I don't want consultations. I want results. In my world, when people fail this badly, there are consequences. And you, doctor, are failing. Hour 10 brought more specialists, fresh faces from other esteemed institutions. Dr. Elizabeth Warren from Boston Children's, Dr. Michael Thompson from Philadelphia. Each one reviewed the same tests, exchanged the same worried glances, and ultimately reached the same despairing conclusions. A medical mystery, an unsolvable enigma. The medical establishment's finest minds, stumped by a case that a black janitor had diagnosed in 30 seconds. Sam watched through the ICU window as Tommy's small body grew paler, more fragile with each passing minute. Vinny hadn't left his son's side, holding the boy's small hand with the desperate tenacity of a man who could buy anything at all, except what he needed most: time. I know what's wrong with him. Kawasaki disease with incomplete criteria. But who would listen to an old janitor? Hour 12 arrived with devastating news. Dr. Peaton addressed Vinny, defeat clinging to him like a shroud. "Mr. Rossini, we're arranging transfer to a specialized pediatric facility in Boston. We've exhausted our diagnostic capabilities here." Vinny exploded. The carefully constructed edifice of his self-control crumbled, revealing the raw, unadulterated terror of a father facing unimaginable loss. 12 hours and you're giving up? In my business, we don't quit until the job is done. It was then that Sam made his choice. Sometimes, doing what was right meant risking everything you had left. He approached the ICU slowly, deliberately. No cleaning cart this time, no subservient posture, just a brilliant physician, finally ready to reclaim his rightful place in medicine, even if it meant confronting a lifetime of systemic injustice. But would anyone listen before it was too late? The clock, relentless and unforgiving, ticked away. Sam approached the ICU with steady, determined steps. His weathered hands, though still bearing the marks of decades of manual labor, were held with a newfound purpose. The humiliation still burned in his chest, a low, simmering ember, but it was now overshadowed by an inferno of resolve. No cleaning cart this time. No invisible janitor routine. Just a brilliant physician, finally ready to reclaim what had been so cruelly stolen from him 45 years ago. Vinny stood guard outside Tommy's room, a sentinel against the encroaching darkness. His expensive suit was a rumpled testament to endless hours of helpless waiting. Dark circles bruised the skin beneath his eyes, and his legendary composure had completely cracked under the crushing weight of a father's worst nightmare. "Mr. Rossini, may I speak with you about your son?" Vinny looked up, his eyes bloodshot and weary. He recognized the janitor, but saw something entirely different in his bearing. A strength, a quiet certainty. "You're the cleaning guy? What do you want?" "I want to save Tommy's life." The words hung in the sterile air between them, stark and audacious. Vinny studied Sam's face with the intensity of a man who had survived by reading people accurately, by discerning truth from deception. He saw no pity, no false hope, only conviction. "Listen, old man, I appreciate whatever you're trying to do, but these doctors... Your son has Kawasaki disease with coronary artery involvement. The intermittent fever pattern, the polymorphous rash that appears and disappears, the unilateral cervical lymphadenopathy. I've diagnosed this exact presentation dozens of times during my medical career." Vinny froze completely. The casual, dismissive tone vanished from his face, replaced by a dawning, terrifying comprehension. What did you say?" "The doctors upstairs are looking for typical presentations, textbook cases. But Tommy has incomplete Kawasaki disease. It's rare, often missed, and if left untreated for another 6 hours, it will cause permanent coronary artery aneurysms. Your son could suffer sudden cardiac death within days." The medical terminology flowed from Sam's mouth with the authority of someone who had spent decades mastering pediatric cardiology. Vinny's street instincts, honed by years of life or death decisions in a far different world, recognized genuine expertise when he heard it. The words resonated with a terrifying truth. How the hell would you know that? Sam reached into the inner pocket of his worn janitor's jacket, pulling out a faded, dog-eared medical journal. He had kept it hidden for 15 years, a secret testament to his true calling. The pages were marked with careful annotations, highlighting recent research on atypical Kawasaki presentations. "Because I didn't always clean floors, Mr. Rossini." Vinny's eyes widened as he saw the complex medical diagrams, the detailed case studies, the dense scientific language that no janitor should ever understand. "You're serious about this?" "Deadly serious. Tommy needs immediate IV immunoglobulin therapy at 2 grams per kilogram body weight, high-dose aspirin therapy to prevent coronary complications, and an echocardiogram to assess current cardiac involvement. The treatment window is closing rapidly." Sam's voice had transformed completely. Gone was the subservient janitor who emptied trash and apologized for existing. This was Dr. Samuel Washington, one of the most brilliant diagnostic minds in pediatric medicine, finally allowed to practice his craft. Vinny studied Sam's face with the intensity that had kept him alive in a dangerous world. Years of reading people, of distinguishing truth from deception, of making split-second decisions that determined life or death. He had seen charlatans and cowards. Sam was neither. Those doctors upstairs, 12 specialists from the best hospitals in the country, they got nothing. And you're telling me you know what's wrong? I'm telling you that while they've been running unnecessary tests and protecting their egos, your son's coronary arteries have been slowly dilating. We have maybe 4 hours before the damage becomes irreversible. Why should I trust you? Sam looked through the ICU window at Tommy's pale face, machines surrounding his small body like silent mechanical guardians. Because I've been studying medicine for 45 years, Mr. Rossini. Because I've diagnosed Kawasaki disease in 23 children during my career. And because those doctors won't listen to me for the same reason this hospital has kept me cleaning floors instead of saving lives. The racial subtext hung heavy between them, unspoken but profoundly understood. Vinny, a man who navigated complex power structures every day, understood implicitly how the system worked, how it conspired to keep certain people in their designated inferior places. What do you need me to do? Get me 5 minutes alone with Tommy. Let me perform a proper physical examination. If I'm wrong, you'll never see me again. If you're right, you save my boy's life. They shook hands. The mafia boss and the brilliant physician disguised as a janitor. An unlikely alliance, forged by desperation and a shared recognition of genuine, undeniable expertise. The doctors are in another consultation. You've got 5 minutes. Room 314. Don't waste them. Sam approached Tommy's bedside with the reverence of someone returning to their true calling after decades of exile. His weathered hands moved with surprising grace and medical precision, a silent symphony of forgotten expertise. He checked pulse points, palpated lymph nodes, examined fingernails with the systematic approach of a master diagnostician. Every movement was deliberate, efficient, infused with an almost sacred care. Bilateral conjunctival injection without purulent discharge. He spoke to himself, to the boy, to the invisible medical community that had long ignored him. He was performing, not for an audience, but for the patient. Strawberry tongue with prominent papillae, perianal desquamation beginning on both hands. His examination was thorough, professional, and exquisitely gentle. Every movement spoke of decades of experience caring for critically ill children, of an empathy that transcended the cold mechanics of medicine. Sam gently lifted Tommy's hospital gown, revealing what the specialists had missed. There, polymorphous rash on the trunk appears and disappears cyclically. They probably dismissed it as a viral exanthem because of the intermittent presentation pattern. Vinny, watching from a respectful distance, felt a growing amazement. Sam was demonstrating knowledge that surpassed every single specialist who had examined his son. Knowledge so precise and intuitive it was almost frightening. The lymph nodes. Unilateral cervical lymphadenopathy, approximately 2 centimeters, consistent with Kawasaki criteria. From his jacket, Sam produced his treasured stethoscope, polished despite years of hiding. It was more than an instrument. It was a symbol, a relic of the physician he had never stopped being. He placed it on Tommy's small chest with the careful reverence of a priest performing a sacred ritual. Grade 2 out of 6 systolic murmurs. Early signs of coronary involvement. We have perhaps 4 hours before permanent cardiac damage occurs. Why are you helping us? You don't know us. You don't owe us anything. Sam looked at Tommy's peaceful, trusting face, then at the desperate father beside him. Because every child deserves the best medical care available, regardless of who their family is. Because a parent's love transcends all social boundaries. And because for too long, I've been denied the chance to use my knowledge to save lives. I won't let another child suffer because of that injustice. As they prepared to leave the room, Sam's fingers instinctively brushed against his medical school ring, hidden deep in his pocket. Howard University, class of 1978. Summa cum laude, hidden for decades, but never forgotten. What happens now? Now, you use your considerable influence to make them listen. And I use my medical expertise to save your son's life. The alliance was formed, fragile yet powerful, between a street king and a forgotten medical genius. But could they convince a medical establishment steeped in prejudice to listen to a black janitor's diagnosis before Tommy died? The clock, with its relentless, unforgiving rhythm, was still ticking. Conference Room B erupted in chaos. 12 specialists, engrossed in their fruitless deliberations, spun around in shock as Vinny Rossini burst through the door with violent force. Behind him, Sam Washington, no longer carrying cleaning supplies, walked with an unyielding dignity. He was a physician reclaiming his rightful place, his stride purposeful, his gaze steady. "Meeting's over, Doc. We need to talk." Dr. Peaton's carefully constructed composure shattered instantly. "Mr. Rossini, this is a restricted medical consultation. You cannot simply... This man knows what's wrong with my son." The room fell into stunned, disbelieving silence. 12 of the East Coast's most prestigious specialists stared at the elderly black janitor with expressions ranging from utter disbelief to outright contempt. The sight of a custodial worker standing in their sacred medical space felt like a violation of the natural order, an affront to their carefully guarded professional hierarchy. Dr. Carter suppressed a nervous laugh, her voice dripping with condescension. "Mr. Rossini, surely you can't be serious about listening to medical advice from... His name is Dr. Samuel Washington, and every single person in this room is going to listen to what he has to say." Dr. Piton's face twisted with a mixture of racist indignation and professional outrage. His worst nightmare was unfolding before his eyes. "This is absolutely absurd. We cannot allow custodial staff to interfere with a serious medical consultation involving a critically ill child." A young resident, unable to contain his scorn, whispered loud enough for everyone to hear. Has the old man finally lost his mind completely? Does he think watching medical shows makes him qualified? Another added with cruel amusement, echoing the earlier jibe. "Maybe he's been reading medical textbooks while emptying our trash cans. Think that counts as continuing education?" The mockery cut deep, a familiar ache for Sam, but he stood his ground with the unyielding dignity of someone who had endured decades of systematic racism and emerged with his intellect not only intact, but sharpened. He had faced far worse than these petulant, arrogant children. All eyes turned to Sam. The distinguished black man straightened his shoulders, pulling back his broad shoulders. 45 years of suppressed medical expertise, finally given permission to emerge from the shadows where institutional prejudice had kept it hidden. "Tommy has Kawasaki disease. You've been treating individual symptoms instead of recognizing the complete clinical constellation." Dr. Piton's laughter, sharp and ugly, carried racist undertones and professional arrogance. "Sir, Kawasaki disease presents with persistent high fever exceeding 5 days duration, which this patient clearly doesn't demonstrate. You've obviously been reading outdated online medical information. The fever is cyclical. You've been checking his temperature at standard 6-hour intervals, completely missing the specific spike pattern. Check your detailed nursing records from 6 o'clock a.m. and 2 p.m. yesterday." Dr. Martinez, his face visibly paling, reviewed the electronic medical record on his tablet. The screen glowed, illuminating his dawning horror. There was a documented spike to 104.2 degrees at 6:17 a.m. yesterday, and another to 101.8 degrees at 2:23 p.m., but they normalized within 2 hours. Classic incomplete Kawasaki disease presentation. The polymorphous rash appears and disappears cyclically. You documented it as transient viral exanthem because it doesn't follow standard textbook timing patterns. Sam's expertise emerged with systematic precision, dismantling their collective failure piece by piece. Check his conjunctiva. Bilateral injection without purulent discharge. Examine his oral cavity. Strawberry tongue with prominent papillary changes. Palpate his neck. Unilateral cervical lymphadenopathy exceeding 1.5 centimeter diameter. Dr. Kim reluctantly reviewed the physical examination photographs stored on her tablet, her fingers trembling slightly. There is documented conjunctival redness and the tongue does show papillary prominence. The lymphadenopathy was noted but dismissed as reactive. You documented every symptom individually, but failed to recognize the diagnostic constellation. Tommy meets 4 of 5 major criteria for Kawasaki disease, plus multiple minor criteria that confirm the clinical diagnosis. Dr. Piton's authority crumbled, his racist assumptions systematically destroyed by irrefutable medical facts. Even if you're correct about some clinical observations, this diagnosis requires years of specialized pediatric training. You're a maintenance worker. This is completely inappropriate and potentially dangerous. Test me.
What?
Test my medical knowledge. Ask me anything about Kawasaki disease. Pathophysiology, treatment protocols, complications, or differential diagnosis. I'll answer every question with the precision you'd expect from any board-certified pediatrician in this room. Dr. Piton, despite his crumbling authority, could not resist the opportunity to publicly humiliate an elderly black man who dared challenge his medical authority in front of his esteemed colleagues. It was a last, desperate grasp at control. Fine. What's the primary serious complication we monitor for Kawasaki disease? Coronary artery aneurysms occur in 20 to 25% of untreated cases, with giant aneurysms developing in 2 to 3% of patients. These can lead to myocardial infarction, sudden cardiac death, or chronic ischemic heart disease. Treatment window is optimal within 10 days of symptom onset, but maximal therapeutic efficacy requires initiation within 48 to 72 hours. Dead silence filled the conference room. 12 specialists stared, their faces etched with a mixture of shock and dawning horror. They were listening to expert-level medical knowledge. delivered with an authority that left no room for doubt. Treatment protocol? Intravenous immunoglobulin at 2 grams per kilogram administered over 10 to 12 hours as first-line therapy, combined with high-dose aspirin at 80 to 100 milligrams per kilogram daily, divided into 4 doses until fever resolution, followed by low-dose maintenance therapy. For IVIG-resistant cases, consider methylprednisolone or infliximab as second-line agents. More uncomfortable silence. The medical elite realized they were being systematically outclassed by the man they had dismissed as Gramps. Diagnostic criteria? American Heart Association guidelines require fever duration of at least 5 days, plus 4 of 5 principal clinical features: bilateral conjunctival injection, oral mucosal changes, peripheral extremity changes, polymorphous rash, and unilateral cervical lymphadenopathy. Tommy demonstrates incomplete Kawasaki disease with all 5 criteria if examined properly. Dr. Carter looked profoundly uncomfortable, her gaze falling to her hands. His knowledge of current treatment guidelines is completely accurate. Dr. Martinez nodded slowly, his eyes wide with surprise. The symptom pattern does fit if we consider atypical presentations. Where did you possibly learn this level of medical detail? Howard University College of Medicine, class of 1978. Graduated summa cum laude, internal medicine residency with a pediatric cardiology fellowship. 45 years of clinical experience before systemic racism systematically drove me from medical practice. The room exploded in shocked silence. Piton's face, a mask of racist fury and professional embarrassment, was a terrible sight. Working as custodial staff raises serious questions about your current medical competency. Questions about my competency? I graduated at the top of my class from one of America's most prestigious medical schools. I've diagnosed and treated more complex cases than most physicians in this room will see in their entire careers. The only question is why a brilliant black physician was systematically excluded from practicing at appropriate levels because institutions valued cultural fit over clinical excellence. I will not allow some displaced practitioner to compromise patient care. Compromise? You're compromising Tommy's life while protecting racist assumptions. While you order unnecessary tests covering diagnostic incompetence, that child's coronary arteries are dilating irreversibly. In 6 hours, the cardiac damage becomes permanent. Vinny, who had been observing with a terrifying calm, delivered his calculated power play with perfect timing. Dr. Peaton, you know who sits on this hospital's board of directors. My friend Anthony Caruso donated $2 million for this pediatric wing. One phone call from me, and your career at Mount Sinai ends tonight. The threat hung in the air like a loaded weapon, cold and absolute. Piton realized he was trapped between his entrenched racial prejudices and potentially career-ending consequences. Dr. Carter, ever the pragmatist, broke the tense silence. What if we perform an echocardiogram to check for early coronary changes? If there's dilation, it would definitively support the Kawasaki diagnosis. Sam nodded with medical authority. Agreed. But understand, we don't have time for extensive testing protocols. Every hour of delay increases the risk of permanent cardiac complications that could kill this child. The cardiology lab hummed with an almost unbearable tension. Dr. Jennifer Walsh, the chief of pediatric cardiology, her face etched with concentration, operated the ultrasound machine. Tommy lay still on the examination table, a tiny, fragile figure. Vinny, his hand gripping his son's, stood sentinel. 12 specialists, their earlier arrogance replaced by a strained curiosity, crowded around the monitor, their breaths held. Sam stood in the corner, officially still the janitor, but everyone in the room sensed the profound shift in dynamics. There, mild dilation of the left anterior descending coronary artery, early stage but definitely abnormal for an 8-year-old. Dr. Piton's face drained of color, his jaw slacked in utter disbelief. That's consistent with Kawasaki disease, exactly as I diagnosed. The room fell silent once more, a profound, heavy quiet. 12 prestigious specialists confronted the stark, undeniable reality. An elderly black janitor had outdiagnosed them all. Dr. Carter, her expression now one of dawning respect, approached Sam. Dr. Washington, your diagnostic capabilities are extraordinary. What's your medical background? Sam hesitated. A lifetime of hiding his credentials, of minimizing his achievements, warring with the sudden, overwhelming urge to finally be seen. I was an attending physician in internal medicine for 20 years, specialized in complex diagnostic cases and pediatric cardiology. Dr. Walsh looked up, her eyes widening with a growing recognition, a flicker of something akin to awe. Dr. Samuel Washington. I know that name from medical literature. You published groundbreaking research on pediatric inflammatory heart disease. Sam nodded slowly, his suppressed professional identity finally, tentatively, surfacing. You're familiar with my work? Your 1999 study on incomplete Kawasaki disease presentations changed how pediatric cardiologists approach diagnosis. Your criteria helped identify patients who would have been missed using traditional guidelines. The room fell into a profound, almost reverent silence. The crazy janitor they had mocked, dismissed, and ridiculed was a published researcher whose work they had unknowingly cited for decades. Dr. Patton struggled to process this information, his entire racist worldview crumbling around him like a house of cards. A janitor who had contributed more to pediatric cardiology than most physicians achieved in entire careers. What brought you to work here in this capacity, Dr. Washington? Sam's voice, when he spoke, carried the weight of decades of pain, a quiet devastation that filled the room. Systemic racism in American medicine. Despite my credentials, published research, and clinical experience, I was consistently rejected by major medical centers. Cultural fit was the euphemism. I wasn't the right type of physician for prestigious institutions. The truth hung heavy in the air, a bitter indictment of the system. Everyone understood the tragic waste of human potential, the institutional barriers that kept brilliant minds from practicing medicine. After 15 years at underfunded community clinics, while my applications were repeatedly rejected by hospitals like this one, I was pushed out of practice entirely. The system made it clear that a black physician would never be welcome at Mount Sinai's level. Vinny, listening intently, recognized a fellow survivor of systemic discrimination, albeit in a different arena. You gave up everything. I gave up practicing medicine, but never my commitment to healing. Being a physician isn't about titles. It's about knowledge, compassion, and moral courage when lives hang in the balance. Your research on inflammatory cardiac conditions influenced pediatric cardiology for decades. You're considered a leading expert on atypical Kawasaki presentations. Word spread through the hospital like wildfire. The janitor was a medical legend whose work they had studied for years without knowing the author cleaned their floors. Dr. Piton, his face now a mask of complete humility and profound shame, approached Sam. Dr. Washington, I owe you a profound apology. My prejudices nearly cost a child his life. Sam, with a grace that transcended decades of humiliation, extended his hand. We both learned something today, Doctor, but Tommy needs us to focus on healing. Will you help us treat him officially? Sam looked at Vinny, who nodded desperately, his face a silent plea. I cannot practice legally without re-credentialing, but I can guide treatment and ensure Tommy gets optimal care. The hospital staff now saw Sam differently. Nurses nodded respectfully. Residents, their earlier arrogance replaced by genuine curiosity, asked questions. The janitor's uniform hadn't changed, but everything else had transformed. Would you consider consulting on challenging cases? Your expertise could save countless children. Sam smiled, a genuine warm smile that reached his eyes for the first time in years. I'd be honored. This is why I became a physician, to help children like Tommy. Tommy stirred, opening his eyes, his gaze unfocused. Papa? Vinny's eyes welled with tears. I'm here, son. Dr. Sam will make you better. Tommy looked at Sam curiously, his small brow furrowed. Are you really a doctor? Sam smiled warmly. I'm someone who believes every child deserves the best medical care possible. Hour 14 arrived with coordinated medical precision. ICU room 3114 transformed into a battlefield against time. Dr. Carter, her movements swift and sure, prepared the IV immunoglobulin. Dr. Martinez, his brow furrowed in concentration, calculated aspirin dosages with mathematical exactitude. Sam stood at Tommy's bedside, no longer hiding his expertise, finally allowed to practice medicine at his highest level again. IV access in the right antecubital vein. Large bore catheter, 18-gauge minimum. The immunoglobulin solution is highly viscous and requires adequate flow rates to prevent hemolytic complications. Dr. Peaton, now completely humbled, took careful notes like a diligent medical student. What's the exact dosage calculation, Dr. Washington? 2 grams per kilogram body weight. Tommy weighs 24 kilograms, so 48 grams total. Infusion rate should not exceed 0.5 milliliters per kilogram per hour initially, then increase gradually as tolerated to prevent adverse reactions. The medical team worked with a newfound respect for Sam's expertise, following his guidance with the deference usually reserved for department chiefs. 2 hours into treatment, chaos erupted without warning. Alarms screamed throughout the ICU as Tommy's heart rate rocketed to 180 beats per minute. Blood pressure plummeted to 70/40. The monitors flashed urgent red warnings that pierced the sterile silence like emergency sirens. "What's happening to my son?" Dr. Carter checked the IV site frantically, her hands trembling with professional fear. "Possible anaphylactic reaction to the immunoglobulin. This is life-threatening." Sam studied the monitors with laser focus, his eyes sharp and analytical. 45 years of critical care experience guided his analysis, instantly separating panic from precise diagnosis. "No, this is an acute hemolytic reaction secondary to rapid infusion rate. We need to stop the infusion immediately and switch to an alternative protocol." Alternative protocol? Sam closed his eyes for a brief moment, drawing from decades of experience treating complex pediatric cases that most American physicians had never even encountered. High-dose methylprednisolone, 30 milligrams per kilogram daily for 3 consecutive days. It's more aggressive than standard American protocols, but Tommy's immune system is rejecting first-line therapy. I've never used corticosteroids as primary treatment for Kawasaki disease, because it's controversial in traditional American practice, but I've published research on this exact scenario: IVIG-resistant Kawasaki disease. Japanese centers use this protocol with 85% success rates. I've personally managed 12 similar cases with excellent outcomes. Vinny pulled Sam aside, desperation etched in every line of his face. "Doc, give it to me straight. What are Tommy's real chances?" "Without treatment, there's a 25% chance of permanent coronary damage with possible sudden cardiac death. With the steroid protocol, it's untested in most American centers, but based on my research and clinical experience, there's a 90% chance of complete recovery." "What would you do if this was your own grandson?" Sam remembered all the children he was never allowed to treat because of systemic racism, brilliant diagnoses dismissed, innovative treatments rejected because of skin color. "I would trust 4 decades of medical knowledge and fight with everything I have for his life." Hour 16 brought the steroid gamble. Dr. Carter, under Sam's careful guidance, administered the methylprednisolone. Tommy's small body, so fragile, was fighting a massive inflammatory response attacking his cardiovascular system. Machines monitored every vital sign, each beep a small battle won or lost. Sam watched with the intensity of someone finally allowed to practice medicine at his highest level, his gaze unwavering. Heart rate stabilizing at 140, blood pressure improved to 85/50. Good initial response, but monitor for steroid complications, hypoglycemia, mood changes, immunosuppression. Hour 18 delivered a devastating setback. Tommy developed severe abdominal pain, began vomiting bile-stained fluid. His temperature spiked to 104.2 degrees despite the treatment. The steroids aren't working. Sam examined Tommy with a thoroughness that spoke to decades of pediatric experience, his hands gentle yet firm. "No. This is expected disease progression. The inflammatory cascade intensifies before resolution begins. His immune system is fighting the aberrant response. We maintain the current course." Vinny, who hadn't slept in 30 hours, his legendary composure completely shattered, slumped into a chair. "Sam, I've done terrible things in my life. Hurt people, made enemies. But Tommy's innocent. He doesn't deserve to pay for my sins." Sam sat beside him, compassion radiating from him, born from a profound understanding of systemic injustice and human suffering. "Mr. Rossini, disease doesn't discriminate based on our past mistakes. Children remain pure regardless of family circumstances. My job, our job, is protecting that innocence." Hour 20 arrived with Tommy's most dangerous crisis. Blood pressure dropped to a critically low 65/35. Breathing became labored and shallow. Cardiac monitors showed dangerous irregular rhythms that could prove fatal at any moment. "We're losing him." Sam studied the monitors with laser focus, decades of suppressed medical expertise now fully unleashed, sharp and unwavering. He's developing distributive shock secondary to systemic inflammation. The vasculitis is compromising cardiac output. We need aggressive hemodynamic support. Dopamine infusion starts at 5 micrograms per kilogram per minute. If no response in 30 minutes, add dobutamine at 2.5 micrograms per kilogram per minute. Dr. Carter nodded, a growing respect replacing her fear. "Dr. Washington, you're directing this resuscitation with expertise beyond most of us. I'm sharing knowledge that should have been utilized decades ago. Medicine works best when we combine experience with humility. Monitor urine output every 15 minutes. Kidney perfusion is critical. Check arterial blood gas and lactate levels hourly. If we see metabolic acidosis with lactate above 4, we'll need sodium bicarbonate." Hour 22 brought the miraculous turning point. Tommy's fever broke dramatically. His heart rate normalized to 95. Blood pressure stabilized at 95/60. Natural color returned to his previously pale cheeks. There, cardiac rhythm regularizing, systemic inflammation responding to treatment, coronary vasculitis resolving. Tommy opened his eyes slowly, focusing on his father's worried face. "Papa?" Vinny grabbed his son's hand with trembling fingers, tears streaming down his face. "I'm here, buddy. Dr. Sam saved your life." Tommy looked at Sam with innocent curiosity. "Are you really a doctor?" Sam smiled with the warmth of someone finally allowed to be himself, finally seen for who he truly was. "I'm someone who believes every child deserves the very best medical care possible." Dr. Walsh reviewed the follow-up cardiac ultrasound with amazement. Coronary artery dilation completely stabilized. No progression to aneurysm formation. Everyone knew, if they had delayed another 6 hours, Tommy would have suffered permanent, potentially fatal heart damage. Hour 24 arrived with Tommy sitting up independently, asking for apple juice, and wanting to go home. Complete recovery, achieved through Sam's expertise and unwavering determination. Vinny turned to Sam with profound gratitude, his voice thick with emotion. "How do I repay this? Money, favors, anything?" Sam shook his head with dignity. "Just be the father Tommy needs. Show him that people can change, that we can be better than our worst mistakes. That's enough payment." Day 3 arrived with Tommy Rossini walking the pediatric ward independently, his IV removed, and his spirits completely restored. Laboratory values had returned to normal. A follow-up echocardiogram showed complete resolution of all coronary artery changes, with no residual cardiac effects. The little boy was whole again. Dr. Carter, her voice now brimming with obvious respect, presented the case during grand rounds. Atypical Kawasaki disease, correctly diagnosed by our clinical consultant, Dr. Samuel Washington. Treated with an innovative methylprednisolone protocol, the patient achieved complete recovery with no cardiac complications. Sustained applause filled the conference room as medical professionals who had once dismissed Sam now recognized his life-saving expertise, their own prejudices laid bare by the undeniable truth. Dr. Walsh addressed the assembled staff, her voice ringing with newfound conviction. "This case reminds us that medical expertise transcends titles and prejudices. Dr. Washington's knowledge saved a child's life when our conventional approaches failed." Sam stood quietly, wearing both his janitor's uniform and his stethoscope with equal pride. Vinny found Sam in the hospital chapel, a quiet sanctuary where Sam had prayed each morning for 15 years. "Sam, I can never repay what you've done. Seeing Tommy healthy and practicing medicine again, that's payment enough." Vinny placed a thick envelope on the pew beside Sam. "For reclaiming your rightful place in medicine." Sam didn't open it immediately. The real gift was Tommy calling him doctor again, the recognition in a child's innocent eyes. Dr. Peaton approached, his demeanor one of complete humility, a profound change from his earlier arrogance. "Dr. Washington, we want to offer you a formal position as senior clinical consultant. Your expertise deserves institutional recognition." Sam considered carefully, a quiet smile on his lips. "I appreciate that, but I also want to continue my custodial work. This hospital needs both types of care. I can provide both with equal dedication." Tommy's discharge day arrived with celebration. Vinny carried his healthy son to the elevator, a beaming smile on his face. "Dr. Sam, will you be here for my checkups?" Sam waved with warm affection. "I'll be here, taking care of other children who need help." Sam returned to his evening routine, but everything had changed. Medical residents stopped to discuss cases respectfully. Nurses sought his input with genuine appreciation. The janitor's uniform remained, but respect had been earned through excellence, through a life-saving display of undeniable competence. His stethoscope hung openly around his neck, no longer a hidden shame, but a proud symbol of knowledge conquering prejudice. 1 month later, Mount Sinai Hospital buzzed with a transformation that extended far beyond Tommy Rossini's miraculous recovery. Tommy bounced into the pediatric cardiology clinic with boundless energy, completely healthy and vibrant. His follow-up echocardiogram showed perfectly normal coronary arteries with no residual effects from Kawasaki disease. "Dr. Sam!" Dr. Walsh smiled with satisfaction. "Textbook perfect recovery. No activity restrictions whatsoever. He can participate in any normal childhood activities. His heart is absolutely perfect. No evidence he ever had this condition." Sam now divided his time equally between custodial responsibilities and formal medical consultation. Hospital administration, recognizing expertise wherever it existed, had created the unique position of senior clinical advisor for complex diagnostic cases. 4 days weekly, Sam reviewed challenging diagnoses with medical residents and attending physicians. His diagnostic accuracy rate in complex cases reached 96%, higher than most department chiefs achieved. Dr. Piton had become Sam's most vocal advocate, a testament to his profound change. I was perpetuating unconscious systemic racism. Sam taught me that medical brilliance transcends skin color, and wisdom doesn't require conventional career paths. The pediatric department routinely consulted Sam on challenging cases. His insights had led to correct diagnoses in 17 cases that had stumped entire medical teams. National media attention brought widespread recognition to systemic racism in healthcare. 60 Minutes profiled Sam's story, "The Doctor Hidden in Plain Sight," which went viral across social media platforms. Thousands of comments poured in from healthcare workers sharing similar stories. Brilliant minority physicians working below their capabilities. Foreign-trained doctors whose expertise was dismissed. Older physicians forced out by discrimination. Mount Sinai partnered with civil rights organizations to identify and support underutilized medical professionals. Sam became the primary advocate for recognizing hidden medical talent, regardless of current employment status. Medical schools nationwide invited Sam to lecture on diagnostic reasoning. His presentations became required viewing for pediatric residents across the country. Vincent Rossini established the Dr. Samuel Washington Foundation with a $5 million endowment to support minority medical professionals facing systemic barriers. The foundation funded medical license reinstatement, continuing education, and anti-racism training. 43 physicians received assistance in the first year, with 12 successfully returning to full medical practice after years of systematic exclusion. Sam reconnected with Howard University colleagues through video conferences. For the first time in 15 years, he felt complete as a physician, respected, valued, and practicing at his highest capabilities. Mount Sinai implemented comprehensive policies to identify and utilize expertise wherever it existed. 3 additional custodial workers revealed significant medical backgrounds. A security guard disclosed emergency medical technician training. Sam still arrived punctually for his night custodial shift. He mopped floors meticulously, maintained pristine hospital cleanliness with the same dedication he brought to medical consultation. I perform both roles with equal pride. Healing environments require clinical excellence and environmental cleanliness. I contribute to patient care, whether holding a mop or a stethoscope. 8 months later, 7 minority physicians working in non-medical roles at Mount Sinai had been identified and supported toward full medical practice reinstatement. Sam's case became mandatory study in medical schools nationwide, recognizing and overcoming systemic racism in healthcare institutions. Tommy visited Sam monthly, bringing drawings of doctors and hospitals. "When I grow up, I want to help sick kids like Dr. Sam does, no matter what they look like." Sam framed his first paycheck as senior clinical advisor, next to his Howard University medical diploma. 2 pieces of paper, 45 years apart, representing an identical commitment to healing and a triumph over institutional prejudice. The janitor's uniform hung beside his white coat. Both now represented tools of his medical trade. In a healthcare system often judged by credentials and assumptions, Dr. Samuel Washington reminds us that true medical expertise lives in knowledge, experience, and compassion, not in the color of one's skin or the prestige of one's current position. Every day we encounter people whose uniforms don't reflect their true capabilities. The janitor who graduated summa cum laude, the security guard who's a trained paramedic, the cafeteria worker who's a licensed nurse from another country. We judge by appearance, we assume by race, we dismiss by age or accent. But brilliance doesn't expire. Medical knowledge doesn't diminish because of systemic racism. Excellence doesn't disappear when society refuses to recognize it. How many Dr. Samuel Washingtons are working in your hospital, your workplace, your community? How many brilliant minds are we systematically overlooking because we can't see past unconscious bias and institutional prejudice? The next time you encounter someone in a service position, remember Sam's story. That person might be a brilliant physician denied opportunities due to racism, a foreign-trained specialist whose credentials aren't recognized, a retired professional working to survive financially, or someone with life-saving expertise you desperately need. America's promise is that talent and hard work will be rewarded regardless of background. But too often, we waste human capital because we can't recognize excellence in unexpected packages. Dr. Samuel Washington didn't become a physician when Mount Sinai finally acknowledged him. He was always a physician. Systemic racism just prevented us from seeing his brilliance. Every Sam deserves recognition. Every Tommy deserves the best possible medical care, regardless of who provides it. Every Dr. Piton deserves the chance to confront their unconscious biases and become better. Dr. Samuel Washington, 68 years old, adjusted his stethoscope in the hospital mirror. The same weathered hands that should have been saving lives for decades. The same brilliant mind that was hidden by institutional racism. The same commitment to healing that never wavered despite systematic rejection. But now, the world finally saw what was always there. A physician who never stopped learning, never stopped caring, never stopped fighting for the chance to save lives. The most dangerous prejudice is the one that prevents us from recognizing life-saving brilliance.